Not every hero wears a cape. In fact, some wear white coats and stethoscopes and a smile when you need it the most.
Everyone who works here has a special dedication to our patients and their families.
It's a privilege to look after these children and to share this journey with their families.
Newark is a high-profile town. People want to come here and people want to stay.
I like making the families feel safe. Hello, how are you?
The people that work here, they chose this job because they love children and obviously want to help them.
Not everything is a rush. Taking extra time with your patients really makes a difference.
I love working with children and their parents and letting them know everything's going to be okay.
We have all go to great lengths to provide the best possible care for our patients.
That's why children and families from across the state and region come to the Children's Hospital of New Jersey, where true heroes deliver excellent care and transform lives.
Children's Hospital of New Jersey at Newark Beth Israel Medical Center is home to the Valerie Fund, founded in 1976 by Ed and Sue Goldstein after losing their daughter to cancer.
The Valerie Fund offers children battling cancer and blood disorders the ability to get the highest quality of care close to home so that they don't have to go into New York City like Ed and Sue did with their daughter Valerie in 1976.
Today, the Valerie Fund at Newark Beth Israel is the largest in the state of New Jersey, providing comprehensive care that includes social work, educational support, integrative medicine, child life programs, and so much more.
You bien? I cannot imagine myself doing anything else, and the support from Valerie Fund really makes a difference.
Child life specialists can be found throughout the hospital, ensuring that all children receive the tools they need to cope with their illness.
Child life specialists are uniquely trained in helping children cope with illness or injury when they are hospitalized in a developmentally appropriate language. We get them to normalize and get them to understand more about what's happening in the hospital, but do it in a fun, appropriate way by getting them out of their bed and going to our playing room, going to our teen room, interacting with familiar objects. But while we're doing those things with our kids, we might be talking about how are they processing and handling their illness or injury while they're here.
15 years ago, Newark Beth Israel embarked on a partnership with the Spirit Halloween Spirit of Children Foundation, a partnership which has now resulted in more than $1 million for child life and priceless moments of joy for children and their families.
Spirit of Children was created in 2006 with an idea that we could go into hospitals and bring the magic and fun of Halloween to kids unable to go out trick-or-treating or attend Halloween parties with their friends and siblings.
We provide our hospitals with costumes and parties so that children who can't have a normal, typical Halloween experience can experience that while they're in the hospital.
But healthy children and healthy communities are built outside of the hospital walls. Rutgers Vice Chancellor and Chair of the Greater Newark Healthcare Coalition, Dr. Denise Rogers, is dedicated to serving patients and communities in Newark.
Throughout my career, I have always served every community that I've worked in.
From her time in San Francisco General Hospital to her initiatives within the city of Newark, Dr. Rogers has held a seat at many tables, but it's her work with RWJBarnabas Health and Rutgers that have redefined community health.
When you bring together an academic health center with a major academic health system partner, we're able to both intervene at the education level, but what we also do is, particularly the RWJBarnabas system, and particularly Newark Beth Israel Medical Center, has a very long-standing commitment to community interventions that aren't necessarily thought of as traditionally being medical interventions, right? And so Newark Beth works with people to eat healthier diets and has community gardens and looks at issues around housing And so what the partnership also allows us to do is to take some of the resources that exist in the university and marry them with the resources that exist in the health system, hopefully to just do our jobs better.
From the moment they enter the hospital to the moment they walk out of its doors, Children's Hospital of New Jersey at Newark Beth Israel Medical Center is shaping a brighter tomorrow today.
Thank you, Newark Beth Israel Medical Center, for this extraordinary recognition of the work of Spirit of Children to make hospitals less scary for kids and their families.
Thank you, Newark Beth Israel Medical Center, for all you do for Spirit of Children and for letting us be a part of your hospital. We are so happy to have this partnership with you.
I am so grateful to Newark Beth Israel Medical Center and particularly Kerri for recognizing my work in the community in this way. Just am enormously, enormously grateful for the recognition. Thank you.
Tonight, we really want to thank Newark Beth Israel for partnering with us, partnering with everyone at the Valerie Fund, and allowing us to provide this support and recognizing the difference we can all make to children and families that have the unfortunate aspect of being diagnosed with a cancer or are fighting a blood disorder. Together, we are much better than separately.